Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture is deaths associated with pregnancy. Now the pregnancy related deaths, the time period that is assorted to these deaths is almost 42 days after the delivery or after even the miscarriages are included in these deaths. So the sections that we'll be discussing one by one. In the first section, we'll be discussing the maternal deaths. The definitions related to these maternal deaths are highly important. What are the time periods that are specific for these deaths? We'll be discussing them in detail over here. And the different terminologies related to them, they're also discussed over here. Now, the statistical measures for maternal mortality are another markers that are very important and they have their own significance. We'll be discussing them in this first section. Therapeutic abortion is sometimes assorted to, and why do we refer to these therapeutic abortions? What are the causes behind it? What are the different modalities and the different methods to which we refer to whenever we are sorting out for this therapeutic kind of abortions? We'll be discussing all of these in this first section. Now, the second section primarily deals with the legal abortions. Legal abortion is another very important modality that we come across, and why do we sometimes have to abort? What are the causes behind it? They can be maternal causes as well as causes related to the fetal origin as well. Now, the deaths associated with abortion, the unsafe abortion, why do we sometimes marks abortion as unsafe for some people and safe for other people? What are the reasons behind it? We'll be discussing all of this over here. The legal terminations of pregnancy are sometimes referred to. Why do we sometimes refer to some abortions as being legal and the others as being illegal? What are the causes behind it? Then the medical and the surgical methods, the modalities that we refer to whenever we are aborting a pregnancy. They can be surgical as well as medical methods, and we can refer to them depending upon the case that we are dealing with. Now, thirdly, in the third section, we'll be dealing primarily with the illegal abortions. Now, the instrumental interference and the insufflation of air are some of the methods that are used for these illegal abortions by quacks practicing out there, and even they are sometimes practiced out there even by trained people that are practicing, and they sometimes carry out these illegal abortions. Now, the dilatation of the cervix, the physical violence, and the syringing and the aspiration method, all of these methods are sometimes referred to for these illegal kind of abortions. Drugs and chemicals, on the other hand, they're also used by some of the practitioners, and the intrauterine infections are sometimes seen in these illegal kind of abortions because these methods are unsafe. When we generally refer to them, they are basically the unsafer methods. Now, in the fourth section, we'll be dealing with the autopsy findings. Now, the external examination is very important to whatever autopsy we are working on. First of all, we have to carefully examine the dead body on the external surfaces. What are the findings? What are the evidences that we can find over there? We'll just note them down and we'll document them down in detail. Moving on, we'll be carrying out the radiological examination of the dead body as well, just to get an overview of the inner side on the radiologies. For example, the X-rays, the CT scans, and the MRIs. Now, the non-radiological findings are again very important, and we'll even document them when we're writing down the autopsy reports of the deaths associated with the pregnancy. In the fifth section, we'll be dealing with the amniotic fluid embolism in detail. And what is amniotic fluid? How can we deal with it? What are the causes for the embolism that it can cause? And the causes are discussed in detail over here in this fifth section. And then the diagnosis. How can we diagnose deaths which are associated with this amniotic fluid embolism in particular? So we'll be discussing all of this in this lecture. So I hope you want to learn more about these deaths associated with pregnancy. So do watch the other sections for this lecture as well.